Hello, good afternoon, everyone from the World Health Organization headquarters in Geneva. My name is Alexandra Kuzmanovic, and it's Wednesday, 5 p.m. local time, when we are here to answer your questions about COVID-19. As this week on Monday, we marked International Women's Day, and yesterday WHO launched the report from the biggest ever study on violence against women. So today, I'm joined with our expert, Lynn Marie Sardina, who is our expert on violence against women data and research here in WHO headquarters. So today we will answer your questions about violence against women in time of COVID-19. Please, as usual, if you're watching us on Twitter, ask your questions by using hashtag AskWHO. If you're watching us on Facebook, LinkedIn, or YouTube, you can ask your questions via comment section. And please note, as usual, that we will moderate the questions, and we'll take today those that are related to violence against women in time of COVID. Good afternoon, Lynn Marie. Thank you so much for finding the time to be with us today and to answer questions from our viewers on very, very important subject. Before we start and before we get some questions, maybe you can tell us more about your work and your professional experience in this area.
Yes, so my work and research on violence against women started in Mumbai, in India, where I was working for an organization called SEHAT, the Center for Inquiry into Health and Allied Themes, and the hospital-based crisis center for women called Dilasa, which refers to help and reassurance. And from then, I've started building more and more my research into prevention of violence against women, and that's when I moved to the UK and worked with the School for Policy Studies at the University of Bristol and also with the medical school looking at psychosocial interventions for women experiencing intimate partner violence, but also at young people's attitudes in India to intimate partner violence and the acceptance of intimate partner violence and the roles that schools could play in preventing this violence. More recently, I've been looking at gender norms in low and middle income countries, individual attitudes, but also community attitudes and societal attitudes that justify violence against women, because we know this is one of the key drivers of actually perpetrating violence against women. And here at the WHO, I work with Dr. Claudia Garcia Moreno, Dr. Avni Amin, and Anna Hoover in the Violence Against Women team, and mainly working on the estimates on violence against women and the data that we currently have at country, regional, and national level.
Thank you so much, and thank you for bringing your rich expertise to WHO, but also sharing your time and advice today with our viewers. You mentioned that you're working on data, and yesterday we launched this report that states that 1 in 3 women around the world are victims of violence, and mostly intimate partner violence. So can you please tell us more about the scale of this problem and the depth of the problem?
Yes, so as you said, it's shocking, and as we mentioned at the launch yesterday as much as it is shocking, it is not surprising that there are such unacceptably high rates of intimate partner violence, and that's 1 in 3 women, as you mentioned, and we have to remember that behind every number is a woman. So we are talking about 736 million women across the globe, and up to 852 million women who have been subjected to physical and or sexual intimate partner violence and or non-partner sexual violence. So that's sexual violence from someone other than a partner. But also it is important to say that a large proportion of this violence is intimate partner violence. So, violence at the hands of a partner remains the most common form of violence against women globally. It is also heartbreaking and a bit devastating to think that this violence starts so early in the lives of women. So with this 1 in 4 adolescent girls and 1 in 4, young women aged 20 to 24 who have already experienced violence by a partner by the age of 24. So by their mid-20s, they have experienced violence at least once. And in terms of, regional differences, what stands out very starkly is that there are huge differences in recent experiences of violence that we measured as in the past 12 months preceding the survey or when the women was interviewed. And this is much higher in lower income countries compared to higher income countries, which may indicate that women with limited resources, or where there are discriminatory family laws or divorce laws or unequal employment opportunities, are more likely to have to remain in an abusive relationships compared to women who have access to the resources and where stigma might be lower. On the bright side, though, we know much more than we've known before about preventing intimate partner violence and violence against women from happening in the very first place. And we know more than we knew 5 years ago or a decade ago in terms of school-based preventions, in terms of community mobilization programs, economic empowerment, challenging gender norms, implementing comprehensive laws and policies. So there's a lot of cash transfer programs that were developed, more with the economic welfare aspect, but then have had a positive impact on preventing violence against women.
Thank you so much. We'll come later to different actions that all of us can do and different parts of societies can do to help us prevent more violence from happening. I would just maybe like here, I'm seeing that we already receive a lot of questions from our viewers, and this subject is always of high interest. But maybe we can remind our viewers as well, what are the forms of violence? When we say violence against women, what do we exactly think?
So violence against women can take various forms, and the ones that we focused here within the report and the ones we developed estimates for are physical intimate partner violence, which is hitting, slapping, kicking, etc., which is sexual intimate partner violence, and that is rape or attempted rape by a partner, but forced sexual intercourse by coercive means as well. And what is less measured, but definitely does not in any way mean that it has less of an impact, is psychological intimate partner violence and coercive controlling behaviors. It's just that we still have a long way to go in measuring these in an adequate way across countries to be able to produce an estimate. And we also measure non-partner sexual violence. So this is sexual violence by friends, acquaintances, other family members other than a partner, neighbors, teachers, religious leaders. And all of these forms of violence have devastating consequences for women, not just when they are experiencing these forms of violence, but across their life course.
Thank you so much. Here we have Shannon Griffin Hanson writing to us saying, I think about this subject daily. I am a domestic violence survivor. I can't even imagine what it's like to go through this during a pandemic. Thank you for researching and bringing awareness to this subject. I praise your efforts. Thank you, Shannon. Thank you for writing to us openly, and thank you for thinking of others who may be experiencing violence, and especially during COVID. So bringing to this, the data in the report we were just talking about includes data up to 2018, but in previous year, Dr. Tedros, our Director General, has mentioned on several occasions that we are seeing more violence against women happening during the pandemic. So can you tell us more about these statements, and how do we know that violence has been even on a rise during pandemic, and why?
Firstly, thank you, Shannon, for sharing with us your experience, and also for the appreciation of the work in this area. So I think before I actually go on to violence against women during COVID-19 during the pandemic, I'd like to very clearly state that violence against women has predated COVID and will continue after, the COVID pandemic is managed. But the COVID pandemic has definitely shown a spotlight on the endemic and epidemic proportions that of violence against women, the violence that women are facing across the globe. And the measures that were taken during COVID-19, for example, the national lockdowns or the restricted mobility measures that aim to stop the spread of the virus, also inadvertently have raised or exacerbated or heightened the risks of women who are living in abusive relationships, because they find themselves trapped in the home with an abusive partner. And while COVID-19 definitely doesn't cause men to become violent or cause men to become abusers, the exposure to having to live with an abuser has increased. The severity of the partner violence may have increased. Also, there are economic tensions now and that has probably exacerbated the risks of violence. And coupled with this increase in severity and increase in frequency, there has also been reduced and limited access services, because these were not considered essential services, but also women were unable to access the services when they are living with a coercively controlling partner. You don't own your own mobile, or you're monitored all the time. You are unable then to access services that you normally would. So at the moment we have data coming up from different countries, but in order to, I think, make a very firm statement and to see the full impact of COVID-19, we would need to, for surveys, population-based surveys, to start resuming, because right now the numbers we have are from services like the health services or the police, other support services, and that might actually underestimate, because not all women are able to access these services, not all women are able to disclose. So the full impact of COVID-19 remains to be seen. But yes, it definitely has shown a spotlight on this pandemic of violence against women.
Thank you so much. You just mentioned that it may be more difficult to reach out to ask for help in this context of COVID and staying at home. But if there is a chance to ask for help, who should those women who are experiencing violence reach out to?
I think the first thing to say to all women out there who are experiencing violence, you are not alone, and you are not to blame for the violence you are subjected to. And this is often, I think, the first step to disclosing or help seeking, because there's a stigma at the societal level which makes it the societal level, but also within communities and within families, that makes it much harder for women to access help. And so I think the first thing is, don't blame yourself for the violence that you are subjected to. Friends, and reach out to friends and family, are a very important source of support if you're experiencing violence, especially in times of the pandemic where there are reduced services, formal services. These other social networks can be helpful, and friends and families play a very important role in supporting women. But also, in terms of the health sector, plays an extremely important role in both supporting women and responding to women who are experiencing violence, but also in preventing violence. So, the work of the WHO Violence Against Women team in training healthcare providers, clinicians, health managers in supporting women adequately is important.
Thank you so much. Mentioning our work with countries and health institutions in countries, have we worked with some emergency responders? So when crises like COVID happen, that those responders and health workers are also aware and trained how to recognize signals of a victim of violence?
Absolutely. So for a few years now, the team, Dr. Claudia Garza-Moreno and Dr. Avni Amin, have been working on a training curriculum for healthcare professionals, healthcare providers, midwives, and healthcare managers on responding and supporting women who disclose violence. And during the COVID pandemic, we have developed guidance that kind of adapts this training curriculum to respond adequately to violence during the pandemic. So rather than having a long-term curriculum, it's an adapted, shorter version because the need now is urgent, and so we need to get that out. So all these materials can be found on the website. We've also developed a module within wider health services research on trying to track the impact of COVID and violence against women, and also on safely collecting data on violence against women during COVID, because I think when suddenly everybody talked about violence against women increasing during COVID, there was this whole rush to collect data without putting in place adequate ethical and safety measures.
Thank you. We were talking now about health workers, health professionals being trained to recognize signs of violence in their patients. How about regular individuals? How can our viewers and each of us recognize if our friend or a family member may be a victim of violence, if they are in fear or they don't feel comfortable sharing, or society is still stigmatizing? What can we look for or maybe recognize as a sign and try to offer help?
Absolutely. I think we all, so we keep talking about policymakers, governments, and other professionals being responsible in terms of response and prevention. But yes, we all in society do play a very important role in responding and supporting women who are experiencing violence, and also in preventing this. And family and friends, neighbors, the community can play a very important role in supporting women who are experiencing partner violence. Disclosure is not easy. And sometimes signs of physical violence, if there are visible injuries, are much easier for family, friends, the community to pick up. But it might be much harder when a woman is in a relationship with a controlling partner or is experiencing psychological abuse. And so we all need to be alert for certain signs. So for example, if a woman, you find that a friend of yours or a family is now less frequently in contact with her friends, or is suddenly not doing social things that she used to do, or is visiting her family very infrequently, it's hard to get in contact with her. These are signs that she might be getting more and more alienated from any social support system, and so it's important to keep this in mind and be alert and in little ways trying to keep in contact, but also learning yourself about the signs of abuse, of recognizing patterns, learning about domestic violence agencies within your community that can access is very helpful for you to be able to help your friend. And also violence against women, but particularly intimate partner violence or domestic violence, is not a private matter. It's not something that needs to be within the four walls. The community needs to get involved. We are all responsible for supporting women who may be experiencing violence.
You mentioned if we notice that our friend or a family member starts isolating herself, that may be a sign. And this becomes even more difficult during COVID-19. As you mentioned, national lockdowns and restrictions, we are all asked to physically distant, to not see each other in person. So it's even harder than to see someone and recognize if something's happening. But as we say, physically disconnected or physically apart, but try to stay socially connected and get in touch with our loved ones and dear ones to check up on regularly.
Absolutely.
You mentioned communities, and here is our Facebook viewer, Shira Land, who is asking, please let us know how can we get involved in our own communities. to support this cause?
Thanks, Shira, for the question, and thanks also for this, the proactive engagement in wanting to support women in your community. I think, firstly, the best way is to be aware in your neighborhood and in your community that looking at this figure of 1 in 3 women always makes me think that we all know someone who has experienced violence at least once in their lifetime. So as individuals, being aware, being an empathetic listener, but also, as I was mentioning, to reach out to local organizations and community-based organizations that are working to support women survivors of violence is one way to begin to get involved, but also in other prevention programs, if there are school-based programs. So, depending on how you can contribute, we can all play an important role.
Thank you. Here is the next question from a Facebook viewer. What steps can be taken to limit staying in an abusive relationship?
Sorry, can you...
What steps can be taken to limit staying in an abusive relationship?
Yes, so I think if I may put it this way, leaving an abusive relationship is not easy. And there are several risk factors we know that keep women in abusive relationships. So besides the psychological and the other controlling behaviors, and violence that women face is not something as straightforward as we sometimes make it think, because the men are not monsters all the time. Yeah, there are periods when they can be very nice and apologize for the behavior, and then it happens again, and that period of apology reduces, but that makes the woman think that things are going to change, and that's one aspect that keep the hope of that this is going to change, and he's really apologetic for what he's done, keeps one aspect that keeps them in violent relationships. But it's also the economic resources. What are the alternatives that women have to remaining in an abusive relationship? So if they're in paid employment, if they have secured jobs and supportive employers, because domestic violence can also lead to loss of days in work, and a lot of women lose jobs and employment because they have frequent days off because of the violence they're facing. So it's employment opportunities, education, so the skills that you have to be employable and independent, but also it's a community and social norms and stigma that play a huge role in keeping women in a violent relationship. So, if marriage is a license to be violent, and then after marriage a woman belongs to her husband and all that he does is acceptable, then women, and they don't have family support if they leave, then women are more likely to stay in violence. So again, it comes down to community and social norm change, but also employment opportunities, education opportunities, non-discriminatory family laws, so family laws that are gender sensitive and don't discriminate against women wanting to leave abusive partners.
Thank you. Speaking of norms, here is the next question. How can norms of acceptability of violence be changed in different cultural contexts?
Yes, it's a very good question. And also, I think this is where you have, because norms are, it's like a chicken and egg situation in some ways as well. So we know that acceptability of violence is one of the key factors that lead to higher rates of violence itself, but also in societies where there are very high rates of violence, it is more normalized and more acceptable. So I think in terms of prevention programs, a lot of them target changing gender norms. It's not straightforward, it's not easy, it is complex at different levels, but there are more promising interventions. We now know that school-based intervention, so using a whole school approach where you're not only talking about healthy relationships, sexuality, comprehensive sexuality education within the formal curricula are important, but it's the other gender stereotypes that are reinforced in schools, whether it's in the playground, etc. But also this community mobilization programs and community economic empowerment programs that are women-led and women-centered, that also challenge gender stereotypes whilst conducting these empowerment programs or cash transfers. Because I think one of the things with focusing solely on economic empowerment programs or on education, it can actually lead to what is known as a backlash. So if we are not changing the attitudes of men, but we are, on the other hand, empowering, inverted commas, women, then men see this as a loss of their sense of entitlement and a sense of their power, which is the underlying factor that's related to partner violence. So it's about changing these gender norms and this acceptability that it is okay for men to discipline or chastise their wives or partners for transgressing any of these social norms.
Thank you so much. Here is the next question from Veronica Douglas. Does WHO help countries develop programs and guidelines on the management in COVID times on violence against women?
Yes. So all of these guidelines, and there are several, if I may say so myself, very useful materials, infographics, Q&As, one-pagers for policymakers, for healthcare providers, for the general public on our website. So please do have a look at that. And one of the main products basically that the WHO and Violence Against Women team has developed is guidance for healthcare providers and professionals on responding to violence against women during COVID.
Thank you. Here is a question from another viewer that the abuse needs to be stopped and abusers need to be punished. Do you have any comment to that?
That abuse needs to be stopped, definitely, and that abusers need to be punished as well, definitely. But I think without going into all the complexities of, whether it's just the criminal justice response or the judicial system response, we need to come back to the fact that violence should not be happening in the first place. There should be zero tolerance for violence, and violence is preventable. We need to change the acceptability and attitudes that say violence is okay in certain situations. It is never okay.
Thank you. You touched on some consequences of violence, but maybe we can explain more. What are the short and long-term consequences that women experiences after being abused?
So violence is really, devastating health consequences for women, but also social and economic consequences for women, for children, for families, and for wider society. We know the physical health consequences of violence in terms of injuries or unintended pregnancies, STIs, and even death. So, in extreme cases, there's a recent report by the UNODC that said over 30% of women who have been killed by an intimate partner. So that's shockingly high number and should be a wake-up call for us. But there are serious long-term mental health consequences, from depression, anxiety, to PTSD, suicidal ideation. But there are also economic consequences and social consequences. So younger women who are experiencing or subjected to partner violence may have to cut short their education or not continue education, which then leaves them less skilled and has those longer term consequences, may not be able to hold stable employment, and this violence that happens at a point in your life is likely to affect you over the life course. So, and in terms of children who have witnessed or experienced violence in the home as a result of intimate partner violence, also we know may be more likely to grow up to either be perpetrators, because this is normalized and they think this is normal behavior within a relationship. And women may also normalize it and grow up to experience it in their own relationships.
Thank you. There are two questions about. One is, are there examples of countries that used to have high levels of violence against women, but have been able to improve drastically? How did they do it? The second one, very similar, is, are there any communities or cities that have an exceptionally good model for response to violence against women and girls? Any models that we can encourage our municipalities to follow? So any good examples of countries, cities, or communities that are having good response to violence against women and significantly managed to reduce the rate?
In terms of significantly, and this is one, so we've collected this data over 158 countries and on intimate partner violence and non-partner sexual violence, and this was over the period of 2000 to 2018. But what we were to this point unable to look at were these trends. So to be able to say that there have been certain countries or communities that have been successful in drastically reducing intimate partner violence, I think at this point is slightly hard to specify. But now that more and more, so when we first did the violence against women estimates that were published in 2013, but with data up to 2010, we had 82 countries that had this kind of data. We now have almost double, so 158 countries with data, but we also have a large number of countries that have more than one survey. And so what we are looking now to do is to see which of these countries have had successful reductions in intimate partner violence, keeping in mind though how tricky this measurement is, and what you need to keep in mind when talking about trends, because as there is more awareness of partner violence, and which hopefully things like this report do and the work of the team is doing, women are beginning to label and name their experiences as violence, something that they might have not done before. So there's greater levels of disclosure. So by looking at numbers, it might not be reducing, but what is happening is women are being more empowered to disclose their experiences of violence.
Thank you for clarifying that. It's a very, very, very good point. Here's the next question from Rosaline Kihumba. Violence and abuse for older women continue to be invisible. Is there a plan to elevate research and interventions for older women?
Thank you very much, Rosaline, for your question, and that indeed is a good question. So the surveys we have and the studies we have currently largely focus on the women of reproductive age, and there is a rationale as well to this, because women of reproductive age, once they start having partners or are married, are more likely to experience violence. However, there is a gap, and this is something we have recognized, and I'll talk a little bit about that in terms of the data we have and surveys that that interview women that are older than 49. So most of, for example, the demographic and health surveys and the reproductive health surveys focus on women 15 to 49, but there are much fewer surveys that then look at 49 plus or 50 plus. So as part of the UN Women and WHO joint program, which is funded by the FCDO in the UK, that is looking to improve the measurement of violence against women and the quality of data. One of the main packages in this is looking at violence against older women, and to develop a module that can either be introduced into violence against women surveys or surveys that focus on older women, because we recognize that there is a gap in research on violence against older women, and also the forms of violence that older women may experience might be different from the forms that younger women experience. So to develop adequate measures that sufficiently capture these forms of violence is one of our main research areas.
Thank you. Here's another comment. Women need more security around the world. Domestic violence can be physical, but when it is emotional violence, it kills women gradually. Is there, in our efforts to prevent violence around the world, there are different measures that policymakers and different institutions in the country can take. What is the educational aspect? Are there any educational interventions to educate women as well on how to recognize signs of abuse or potential abuse by a partner or by anyone, if we think of this psychological abuse?
Yes, so I think in and you're right that something in terms of both measurement and response, service response, but also judicial response or the criminal response, it's much harder to pinpoint and to say that the woman has experienced psychological abuse or controlling behavior, but also the onus of that evidence on the woman to say what she's experiencing is psychological violence. And I think, like the other forms of violence, like physical violence and sexual violence, early interventions or early education, again, just to come back to our findings that 1 in 4 15 to 19-year-olds have already experienced physical or sexual violence, I think highlights the urgent need for this education for both boys and girls to start early in terms of respectful relationships, healthy relationships, consent, recognizing forms of abuse, and that it's not okay. And this applies to whether it's physical, sexual, or psychological violence.
Thank you. The next question comes: what is the impact on children who witness violence against mother?
So this again has been an area of research that has, been going on for a few years, but again, receiving more highlights now because of the long-term impacts. So the consequences of violence in the home, children can be, so if they are directly abused, it can be physical or physical abuse, but also the mental trauma of having experienced their mother being abused by their partner, whether it's psychological or physical or sexual abuse, has an impact on them psychologically and mentally, and this can be lifelong, have lifelong consequences, but also that they might then either grow up to normalize this form of violence. So boys might be more likely to say this is normal within a relationship and grow up to abuse their partners, and girls may grow up and think this is also normal. So it is okay for my partner or husband to control me or to physically discipline me if because he is my husband. So yes, it does have long-term consequences and serious consequences on children.
Do we advise governments to work on programs to support children who witness violence in family so that we can help them mitigate this trauma?
Yes, so part of our, in the wider context of looking at violence against women, we also look at the intersections of violence against women and violence against children. And one of our UN partners in the measurement and data program on violence against women and that were critical in developing these estimates was UNICEF, and so we are working on the intersections between violence against women and violence against children, recognizing the implications that violence against women has on children and families.
Thank you. I want to read something before we close. Anita Sharda is watching us on LinkedIn, and she says that I was one of the founding members of the South Hall Black Sisters in 1979 to challenge domestic violence and provide support to Asian and Afro-Caribbean women. I noticed 40 years on the group with new members is still going on and campaigning, which shows the issue does not go away. But women are more empowered and there is better legislation and response from authorities to domestic violence. Thank you, Anita.
Thank you, Anita. Yes, and there is hope. We know, we have to come back to the fact that violence is preventable, and we are learning more and more about how we can stop violence from happening in the first place. And it doesn't have to take decades. It can happen within years. But we need political commitment. We need better funding for services and programs that respond to violence against women, but also working to prevent violence against women. And definitely not just having a large, because we know that there are 155 countries that now have legislation on violence against women. But we need more comprehensive laws, better implementation to actually tackle this problem urgently.
Thank you. Thank you so much, Lynn Marie.
Thank you. Thank you for having me.
Before we close, maybe we can just remind our viewers once again how they can help someone who is experiencing violence in their surroundings, how to look for signs, and how to help, even though we need to stay physically apart at the moment, but that there are ways to offer help.
Absolutely. So I think firstly, recognize that you do have a role to play in responding to violence experienced by family, friends, or community members. Be alert, and as a colleague of mine said, go with your gut instinct. If you think there is something wrong and it's concerning and there is a pattern, there's suddenly a lack of contact, then please do reach out in little ways to the person and encourage disclosure, but also be patient, because it's not very easy to disclose this violence. It's not very easy to leave abusive relationships, but it's important for the woman to know that you are there for them.
Thank you so much.
Thank you.
I thank also all viewers watching us from Chad, the USA, Pakistan, Sweden, the UK, India, Morocco, Oman, Yemen, Nigeria, Lebanon, Algeria, Lesotho, the Netherlands, Romania, Turkey, Mexico, Bangladesh, Somalia, Canada, Senegal, Qatar, Philippines, Kenya, Malaysia, Mauritius, Dubai, Turkey, Ireland, Myanmar, Portugal, South Africa, Switzerland, Saudi Arabia, Sweden, I think I said it twice, Zimbabwe, Greece, Thailand, and many others. Before we close, I would just read a message from Suzanne Claridge, who says, I was in a psychological abuse marriage. Any abuse is awful. Be kind always. And
that's a good note to end on.
Thank you, Susan, for being vocal about your experience and reminding us all that we need to be kind to each other all the time, to our partners, to our friends, family, colleagues, and everyone. Thank you. And
thank you.
Until next week, please stay safe. For more information, you can visit our website or our social media channels on this subject and on COVID-19 updates as well.